Hi, this is Dr. Kandilakis for Restore Wellness. This is the first module of 7 of the American Association of Diabetic Educators' recommended self-care behaviors. Module 1, Healthy Eating. Whether you've been diagnosed with prediabetes, diabetes type 2, or know you feel lightheaded or tired or sluggish after eating a meal high in carbohydrates, you probably have a lot of questions regarding what you can eat and how blood sugar levels from high carbohydrate foods you've been eating is affecting your whole body. Are you wondering if you can go out to eat at a restaurant, or eat your favorite foods, or eat at your friend's house? Are you concerned you have to change your whole diet just because you have diabetes? Well, truthfully, you don't. In fact, you can eat almost anything. So you don't have to give up most foods that you love or be fearful of eating out at restaurants. Now is probably a good time to go over some definitions so that you better understand diabetes. There are 3 categories of nutrients: proteins, fats, and carbohydrates. Common examples of carbohydrates, our main concern, that we eat frequently are pasta, bread, rice, fruits, starchy vegetables such as potatoes, corn, peas, beans, and other foods such as milk and sodas. Sodas have a lot of sugar calories. Examples of fats you would know to be butter, vegetable cooking oil, for example. Examples of good protein sources are chicken and fish, without the skins, of course. Another term that we need to be familiar with is hypoglycemia. It's a term for low blood sugar. Hyperglycemia describes high blood sugar. Another term that's important to understand is glycemic index. It is a system that ranks foods on a scale from 1 to 100 based on their effect on blood sugar levels. A baked potato, for example, has a level of about 85 on the glycemic index. Straight sugar is 100, and an apple has a glycemic index of 38. Why is this important? Higher glycemic index foods create higher blood sugar, which triggers more insulin release. Fat storage is also activated, and if this occurs too frequently, it begins to disrupt the normal manufacture and release of insulin, and triggers the release of other hormones, adrenaline and cortisol. This is not good for your health, as these hormones in excess cause other negative effects to your cardiovascular system, sleep cycle, body weight, energy, and mood, to just name a few. It is extremely important to understand that everything you eat has an effect on your body. Think of food as chemicals that enter your bloodstream and interact with your body's organs and cells and create chemical signals for your brain and organs, such as pancreas, adrenal glands, kidneys, and liver in particular. These organs have a complicated, interrelated job to control your blood sugar, carbohydrate, fat, and protein storage and release. It's like a symphony, and every player has its part to make the whole function properly and maintain health. Therefore, controlling what you eat, when you eat, not missing meals, and having smaller portion sizes with less calories per day, and the ratio of fats, carbohydrates, and proteins play a very critical role in helping you maintain a good blood sugar level, and not stressing your organs to release or store excessive carbohydrates. If you manage your blood sugar properly, eventually you may even reverse your type 2 diabetes. Some people have done this, and now they are no longer taking medications. They just carefully choose what and when they eat. This understanding becomes a skill that your physician, diabetes educator, or licensed dietitian can help you learn about. Some of the topics will be setting goals for healthy eating, meal planning, reading food labels, counting carbohydrates and calories, and measuring a serving or portion size. These skills allow you to manage and possibly even reverse your diabetes. Here's a quiz. Is a green bean a starchy vegetable or a vegetable high in fiber? Answer: the green bean wins. It's a fibrous vegetable. Which fruit is high in fiber and has a low glycemic index? An apple or an orange? The answer is an apple. It is recommended to have 5 servings of what 2 food groups each day? Fruits and vegetables is the answer. True or false? People with diabetes cannot have sugar. False. But be careful. You can have sugar, but sugar has empty calories and no nutrition. It's best to eat sugary foods in small portions and as a reward system. Here's a couple of quick tips. Make sure you eat breakfast every day. Make sure it's a mixed meal, which means it contains protein, carbohydrate, and a little fat. Don't skip meals. Space out your meals. And always carry around a protein bar that has a moderate amount of sugar so that if you run into a situation where you have low blood sugar, you can eat that and level it off. Here are some questions you can ask yourself to get yourself thinking in advance about situations you may be in and to help you manage your blood sugar better. First question: when I want to eat healthy, what do I think I need to do? Number 1, number 2, and number 3. Pick those 3 words and fill in the blanks. Number 2, what did I eat for dinner, for lunch, yesterday? How did I feel after I ate? Number 3, is there anything that I could have done to make my last meal healthier? Number 4, what is the hardest part of eating healthy for you? How do you strategize around improving how you accomplish your goal? Number 5, what is the best part of eating healthy for you? What is your goal? What is it going to allow you to do? How is it going to allow you to feel different? A good exercise for a diabetic person is to actually, in their mind, plan their meal, divide a plate into 4 sections, visually. For lunch or dinner, you can fill half the plate with non-starchy vegetables such as green beans, greens, broccoli, or cabbage, or kale, which is even the best. 1/4 of the plate should contain meat or protein, like fish, eggs, low-fat cheese, cottage cheese, beans, or legumes, and 1/4 of the plate should contain a starch such as a potato or a whole grain. On the side, you can include an 8-ounce glass of low-fat milk or a small piece of fruit. Your next exercise is to imagine what you would plan on your plate. Divide a plate into 4 sections and figure out what you're going to do. This ends Module 1 of the Diabetes Self-Care program. Good luck. We have confidence in you. Have confidence in yourself. You can do this.